Medical Dilemma.
Welcome back to Medical Dilemma. Before we start today's discussions, I'd like first to thank our major sponsor, St. Clair's Medical Center, located at 1838 Dion Street, Palanan, Makati City. Quality, affordable healthcare. And I'd also like to cite LifeQuest Training and Consultancy Corporation. Kindly check their website, lifequestphilippines.com, for their upcoming webinars, seminars, and workshops. Now, going back to the topic for today, joining me now are my co-hosts. We have first Dr. Teresita Sanchez. How are you, Doctora?
Hello, yeah. Nice to see you again.
Nice to see you again, too. And we have Father Jerry Manlangit.
Hi. Thank you, Sonny, and thank you again for having me here.
Welcome. Okay, and we have Attorney Sara Sugitan.
Hi, Sunny, and of course, Dr. C, our guest.
Of course, we have Dr. C back with us again. Now, the last topic we were talking about, okay, with Dr. C and myself, was about the growing practice of plastic surgery, probably also the growing demand for aesthetic services. Okay? I remember when I was living in Thailand, you would see aesthetic centers all over the city. There are like 7-Elevens there. Okay? So I suppose we would see a similar development in the Philippines setting.
I would say, kasi recently I was in Korea and also in Hong Kong. It's like a tourist spot for them. You will see these women in the airport, their heads wrapped in a sort of bandage. Obviously, they have had aesthetic surgery in Korea or in Hong Kong. Especially the Chinese, they have nose lifts, and now I think it's catching on here. And eventually, I think it will become the Philippines will become a popular aesthetic surgery hub in the future. That's what I foresee, no? Pero earlier you were differentiating between cosmetic and plastic surgery. And I think there's a difference, but there's a lack of awareness among let's say, the patients. Like for me, I'm not, if I decide to, for example, have aesthetic surgery, may maintenance ba yan, doctor? I mean, is that something that you have to, for example, have a check-up every 2 years or so? I mean, I think it should be considered if you are thinking about undergoing an aesthetic surgery.
Yeah, usually, if you are undergoing surgery, depending on the practitioner, personally on my side, I ask patients to come back 3 days, 1 week, 1 month, if possible, 2 months after, then 6 months, then 1 year. Why is that? Because when we talk about wound healing takes approximately 3 months to as long as 9 months. So that is what we call the final result. If there is something that we need to talk about with the patient's result, then it would be nice to follow them up through those particular years, if they are available. Because some patients will come in because it's now a norm, when, as you mentioned, they come in, you see a patients in Hong Kong, in China, in Korea, that they go to the airport with bandage all over. It's going to be a norm, eventually. That's something that they have to be proud of. Oh, I have done this.
Yeah, it's different. Many years ago, they promoted, you go to a secluded place, parang hiyang-hiya pa yung mga tao na nagpa-nosebleed sila or not. Now it's not. It's already, everybody's proud, as you have said. They can afford it in the first place. Yeah.
Yeah, that was
with the growth of all of these services, with the phenomenal growth of the demand for such services, then I would expect a lot more questions to be asked, about the practices of cosmetic or plastic surgery. However, I don't see much, happening in the media or anywhere else, a forum of some sort that will clarify issues, for the common person.
Well, I guess because gumaganda naman talaga sila, di ba? I mean,
So,
there's practically
as long
little
as they become
complaints about it,
beautiful,
right?
It's fine.
What I think is this, no? Sometimes we cannot help it. When we're born, sometimes you're born pangit. But I think it's sacrilege, Father, excuse me, nobody should die pangit.
Oh, maybe we should ask Father. Ano ba, Father, in our faith, is that allowed to tamper with God's creation, our God?
You see, no one is born ugly.
Okay.
Beauty is only on the surface.
Yeah, skin
Agree.
deep.
A person who is marked with wisdom is able to see beyond appearances. Those who are unable to do so, well, most of the time they are trapped into vanity later on. You will know that ethicists would like to, well, to make some sort of an ethical guideline, to make a procedure ethically legitimate or valid. First, that bodily or psychical functions can never be sacrificed unless they are for the complete or the whole being of the patient. And even then, with an effort to compensate. Well, and let me say this. For example, if you have to amputate a foot, well, you have to compensate it. You must have crutches, you must have wheelchair, etc., etc. Because bodily and psychic functions are part of the sanctity of the body that you cannot just tamper with unless it is for the whole functioning of the person. And secondly, basic capacities that define our personhood can never be sacrificed unless it is for the preservation of life. Okay, let me see. May I try to expand this? No. First,
Go ahead,
let's go to the first guideline: bodily and psychic functions. No. Well, you cannot just sacrifice a part of your body if it is not going to benefit you as a whole person.
Okay.
Okay. I remember, for example, no, a couple were very rich, but a man was obsessed with tigers. So much so that because of his obsession with the tigers, he does not have any more time with the wife. And so what the wife did was to go to a plastic surgeon, enhance herself, made herself to look like a tiger.
These are the so-called
So that,
furries.
you know,
Yes.
so comes now the issue of, well, did he go there because there was necessity? Was it vanity? Was it insanity?
I think it's necessity, Father.
Insanity.
No, that should not be a basis.
So,
That's a joke.
so you cannot just do or tamper with your body unless it is for the whole functioning of yourself, including your physical attributes. And the second, for example, no, you cannot just tamper with your sexuality unless it is for the preservation of life. Let's say you met in an accident and your sexual organ has been badly mutilated. That if there is no plastic surgery on it, you're going to have infection, you're going to get sick, etc. Better lose it rather than die.
But
Okay? Because sexuality is part of your person. If you don't have sex, I don't know who are you.
Father, in the olden days, you
can
call
that
that
be
eunuchs,
reconstructed?
right?
Yes,
They're-
yes.
It
It
can
can
be.
always be reconstructed.
Right.
You can bring back some semblance of that.
Semblance, yes. Po.
Of that 1%, they call it.
Yes, po.
What about the
Most vital.
functionality?
Functionality may not depending on the amount of the extent of injury. But we can be able to bring back the feature, the physical appearance.
That would be a big moral help to
Yes,
that
for
victim,
patient.
right? Oh.
But how about, doctor, the pleasure that you get out of, well, you're in the sexual act?
That's the right question
Let's
from Father.
The functionality.
Sometimes
din eh.
it
That
is.
goes
They
to the
have asked
functionality.
They ask me,
Yes, yes.
you know your ethics, Father, about the pleasure that should always be there, having that one. But if it is a new tale, something like that.
But there are other ways to give pleasure. As a matter of fact, even among women, we're not so much into that actual thing, diba? We're more into foreplay,
Yes.
right?
Okay.
Going back to
I asked Sarah who's single, my
Because
gosh.
sex change falls under the domain of plastic surgery as well.
Yes.
Correct me if I'm
Right.
wrong, Father. Pero yun nga, my concern is if I am a patient and I am considering plastic or aesthetic surgery, for example, are you aware that some patients probably, like when they consult lawyers, they shop for doctors? Parang they consult one and then
Forum shopping.
forum
Right.
shopping, parang ganon. Do you
Yeah.
also have that case in your practice, in your industry?
Most of my patients have been to several doctors already, or they've been to several clinics at that. And then when they have tried other doctors, then the only thing that will tell you that you did the right thing is the patients come back, the retention patients, those who come back.
Those who come
Because
back, yes. They're happy with you.
like my experience with an attorney, I
Uh-huh.
got a couple of attorney patients.
Mhm.
So as much as I say, attorney, pwede i-refer na lang kita sa my boss.
Ma, natatakot ka ba?
You have that always feeling of,
Right.
But then when I do procedure for them, I try to be realistic with what they're supposed to get. And then if they think that what I'm doing is not enough, they go to other doctors. But eventually, they come back. Why? Because they now see the essence of my being conservative in terms of trying to tell them what they need and what they do not need. Because not all things that patients say, this is what I need, this is what I want you
Right.
to do.
Right.
They bring pictures. I say, oh, that's nice. As long as you have that kind of face, I can do it also.
The
But you don't
shape
have
of
that
the
kind
face.
of face.
Yeah.
So that's being
will
realistic for my
be-
patients.
Discordant.
Yeah, you should level expectations kasi I would think some people when they go to their barber, for example, I want to look like Angelina Jolie, but it's unrealistic. The doctor is not a magic wand that can transform you into a celebrity, by mere surgery.
Yeah,
So
they
in
can
other
make
words,
you-
doctors can also dissuade patients from undergoing a desired procedure.
Ideally, that's what doctors is supposed to
That's
do.
what they're supposed to do.
Yes.
It is, I think, an ethical duty on their part.
Mhm.
Because no matter how good a surgery or a procedure is, should a doctor do it? Is it because the technology is there? Yeah, may have the skill to do it. Is it right for a doctor to do it? And there comes the ethics of the procedure.
And if you want to look like a celebrity, oftentimes you cannot look like her or him, no? You will be the bad example.
Bad imitation.
The other, the imitation there.
Okay. Well, I think we'll have to interrupt our discussions for the meantime, just to give way to some words from our sponsors. Okay. Thank you so much. Be right back.
Many of our products were designed to be used in industrial and medical economy.